My favorite part of the day. Without a cup of coffee, this would be a terrible drive. But I'm up, I'm excited. Saturday's always a fun day because everybody has off in the town. So a lot of patients, a lot of volume, and just good vibes. You know, we try to make the best. I get pizza for the staff. We try to vibe out. I'm just trying to enjoy these moments a little more because the staff makes everything, right? My team is so special to me. I spend so many hours with them, more than my own parents. So it's like, this is my family now, and it's just fun to hang out with them. I'm almost here. We're in Pompano right now. I can smell it. I'm smelling the periodontal disease from over here. I'm still 5 minutes away from work.
Shane, if people are gonna get bored or not.
Hey, buenos dias, Oscar. ¿Todo bien? Hey, buenos dias. Buenos dias, buenos dias. Hey, they like it. It's Leo's the homie. Mauricio. Hey. Gang, gang, it's the best team of all time right there. Look at that. It's Gonzalito. Hey.
It's a good place for work today for dental works. Okay, so welcome to my mission.
Let's go. You already know the DJ. Alright, first consult of the day. Just went into a problematic mom. You know, the thing is that when you're working as an associate, there's sometimes conflict of interest with other doctors who are, you know, in the office, and the other doc recommended to do build-ups and fillings on an 89 for a 12-year-old, and I don't see that working at all. I'm gonna show you the x-ray here. Yeah, patient was definitely super combative, and you just gotta be ready. It's a battle zone. You gotta step into it, the right attitude. Don't forget who's boss. Come on, don't ever let a patient bully you. So, just wanted to give a shout out to these new loops. I'm gonna be completely honest, I've been working for 3 years and I'm getting way too much back and neck pain. But the best thing is like this declination angle. So my other loops, I do like them a lot. This is from Exam Visions, this is a 3.3. But the problem is that you're forced to constantly look all the way down while you're working. And it's super annoying to do long hours. And if you're trying to produce a lot, you have to focus on ergonomics. And it's like stuff just not talked about, but yo, I feel it right now. Like I'm literally doing neck stretches all the time. And this is helping me a lot. And it's something that you have to actively work on as a dentist. Definitely take a look at these, you know, shoot a comment down below if you're interested in trying to like demo them or whatever. But they changed my life, so I'm just throwing y'all on game. All right, let's go do a filling and extraction for a really nice patient of ours. He's a good friend of ours. He's been here for a long time. Look at these guys, man. All they do is just chill. They just be chilling all the time, man. Hablador, huh? Hablador, talker. He's a talker. All right, let's go. $39 for a surgical extraction. And I was like, dude, that's the price of a steak at Olive Garden, dog. It's kind of crazy. Insurance, man. Dental insurance is a hell of a drug for sure. Alright, Les is gonna do the filling and we're about to lock in for the extraction a little bit. Pretty slow day to be honest, not too bad. So now I'm looking at some really cool tech for the office. Just stumbled upon this Sprint Ray Pro 2. Digital's the future, you gotta get involved in it. Definitely a learning curve, but it's just so cool to see where dentistry is in 2025. And yeah, I'm excited to get all this new tech to implement into my own practice and really take it to the next level, right? Because it's all the vision that you have in your head and the type of quality of dentistry you want. Kind of need digital, you need 3D CT scans, you need 3D printers, you need all this stuff. It's a high investment cost, but the quality is gonna be there. So stay tuned for that. Right now, it's pretty bare bones here. Alright, Shirley presents me with a new patient. She says, chief complaint, she was told that she needed a deep cleaning and it wasn't very cost effective. She says she has cavities and a bunch of other problems. Let's take a look. Okay, first things first, you see a lot of plaque and calculus involved. I would agree. Deep cleaning, patient needs it. Patient is, how old do you know how old she is? Recurrent cavities on 3. This root canal has failed, gone, cavity. I'd probably extract that. 3-5 bridge. So there's something here a little bit, okay. Still got the plaque and calculus. There's recurrent cavities under this crown here. I would do a crown on 30. I would do a DO on 29. Do a DO on 12. Let's take a look here. There's high caries risk involved, so you already know that a lot of the restorations are failing. even if it may not seem like it completely on the x-ray. I would do crown on 13. There's something we have as a question mark on 19. This may need endo. Definitely a crown here. What's causing it? Find the root, the treatment that actually needs to be done. Create a phased priority list too, because the patient's not going to pay for all this at once. And the most important thing is to identify, is to establish value in the treatment. You want the patient to realize that, yeah, this may be $5,000, $10,000 worth of work, but it's better than having dentures and no teeth in 10 years, right? So there's definitely a cost to all this, but the importance of a new treatment, a new patient exam, is to establish the value, urgency, and importance of dentistry, because most patients don't really see it. All right, let's go. All right, we got the tag team here. We do this extraction. Let's lock and load. We got Sophie here for support. Perfect.
Oh, she's when you take it out, can I look at it?
Of course.
Yeah.
Of course.
Yeah.
We're going to make a necklace for you.
He said, that's behavior.
All right, let's take a look. So we're extracting 15 here. That's 15. So 14. We're extracting 14. There's a huge cavity here, so I just wanted to show you guys on the x-ray. Bam, right there. So this is going to cause a lot of pain, problems, a lot of bone loss. Tooth needs to come out. All right. Let's lock and load. All right, we're going to give you a little poke to start before we start anything. I'm going to give you poking. If you feel any pain, you can raise your left hand. If not, it's just pressure, okay? It's just pressure like this.
Yeah.
Okay?
Yeah.
Okay. You want to get it in here. Thing here. Sharp pain. Nothing. Yeah, I like to give a good focus on the elbow and the shoulder. A lot of the times young dentists use their wrist too much and they don't really get the force they need. A lot of it is just a movement of nice and clean. You okay?
Yeah, that's what it's hurting.
Yeah, that's
When I was frozen,
look at that thing right there. It's going all the way in there. Right into the nerve.
damn.
Bam, look at that thing. Alright, so now we are doing a extraction implant case. It's really cool, but there's a long spanning bridge. I'll show you the x-ray later. So we section the bridge, and now we're going to do the 2 extractions and then the two implants for a new implant bridge.
First thing I like to do is I like to use a periosteal elevator just to kind of loosen up the junctional epithelium right there. Get that open. All right, first thing I'll do is I'm gonna go for the distal tooth because I know that if I can wedge it in here. A little bit of pressure here. Poquito presión, just normal. So I'm using a lot of the movement from my elbow and shoulder. A lot of the young dentists use it from the wrist, and that's not really helpful. Now, for this one, since I want to preserve the buccal bone, and it may not be easy to move, I'll give it a little try with the forceps. Okay, so this one's kind of already moving. Do we have the other one for the molar? This one's getting a little bit of movement, so in this situation, if it wasn't moving at all, I would section into 3 pieces, and I would take it out root by root. But I'm getting a little bit of movement. This is probably because it was the distal part of the bridge, and it wasn't holding up well. I'm getting a little bit of movement, but I would still prefer to not have to put too much force on it with the forceps, since I am going to put this this implant right here. In this situation, I'm gonna flap it because I want a clear visualization of the surgical site right here. Okay, so now you get the bone out the way, and you get the gums out the way. Here we are. Good. So now I see exactly what I need to. This is the molars, economy source. I don't want to fracture this bone here with the extraction because I need this site. So I'm gonna go ahead and section the tube anyway. Then I'll do that buccal limba cut right here. And rotational as light as you can. And just kind of see if that one root comes out by itself. Should. Perfect. That's exactly what we wanted. You'll break the bone with it. But if you take it into little pieces, you're super like preserving everything, you know?
You're making sure you get everything little by little.
Exactly. We don't want like these huge traumas to the bone areas. All right, the goal is to get into 3 clean pieces, and that's always the goal in your sectioning. So let's see if you can do it. Boom. That's the second piece right there. Cool. And then a rotation. And that'll give us a third piece. It's the best way to do it. We're not yanking on the patient's head or anything. It's super traumatic. So now we have a clean visualization of the whole rig. Where to get the 2 implants. We're gonna go right in the center of the molar. Let's check the X-ray here again. Just to verify. Very thin ridge here. Okay. So from there, I'm gonna get a 35. Yeah, well, the típico. Probably gonna get a 35. Okay, my osteotomy is gonna go a little palatal, which I don't want. So I'm gonna push it. I mean, it's gonna go a little buccal. So I'm gonna push it more palatal. Took it to about 13s. I'm gonna get that implant in there right now. I like that a lot. I got it about 2 to 3 millimeters underneath the bone. It's super thin ridge. All right, let's get that last implant in there and then call it a day for it. So now we're here. We're looking at the molar site. I'm gonna go right in the center for the best prosthetic placement. So now I'm coming in here to this molar site. Right in the center is where you're gonna get the best prosthetic placements. You can try the roots here, here, or here, but I'm gonna go right in the middle. In the middle. Then put it into 26 and take it to the bone level right there. I like that the way it is. You know, I wish I had more torque. Super limited bone there. Fred, tienes tornillo.
Que se ve el duro ahí. Buen equipo, good job.
Yeah.
Muy buen team. Good team. Y el otro.
Ah, el otro aquí.
So you have a super clear. Ay.
Butter refaction.
Let me put.
Okay.
Venga, te lo pongo aquí. Y aquí. Ah, mi po. ¿Quieres?
Yeah. Tiene casa, mojada.
Yeah, tengo casa. Sí.
Doing.
Okay, let me take a look. Okay, these teeth that are causing you a problem, we gotta take them out. But we can replace them with an implant. Alright gang, let's check out the x-ray, come on. Freehand 2 implants, bridge. Let's see what we got. Whew, I'm liking that, gang. I'm liking that a lot right there. Like that, that's nice. Let's see how close we got into that. That was a thin ridge, man. 3.5 on that. What we got? Fuck. Come on, dog. Freehand that thing. Sheesh. Take it. That's a sinus bumped right there too. That was the shortest implant we had. It was a 5.7, and it does bump the sinus membrane up too, so you can get it a little up there. It's self-tapping. All in all, pretty sweet case, and I'm pretty proud of that. Hopefully y'all like some more of that. If you do, subscribe, please. Let me know in the comments below for sure. I'm out of here. Saturday night shift, I'm done. I'm gonna enjoy this next week off. Yo, Sophie. ¿Cómo se dice libre en inglés?
Libre?
Yeah.
Free.
I'm free. Libre. No puede escucharlo. My awesome videographer, camera girl, say what's up to the vlog. Hello. Have a good week. Take care.
You likewise.
Yeah. Alright, we out of here. Finally out of Pompano. This is the real trenches right here, my fam. Back to Miami, let's go! I remember why I chose to be a dentist. Every time I approach this car and it winks at me. Just putting y'all on game right now. Shit is fire. Very good purchase. I'm very happy. Just keep grinding, keep working hard. Anything you want will come true, trust me.